February 22nd, 2026. Let's begin with the pledge. Pledge allegiance to the
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, how about a roll?
Commissioner Hoffmaster, Commissioner Leininger,
Here.
Commissioner Collins,
Here.
Commissioner Schaefer,
Here.
Commissioner Scholl.
Present.
Thank you.
Okay. We're up to the approval of the agenda. Had a chance to check that out.
I would move to approve the agenda as presented.
Support. Okay, we have a motion of support. Any discussion? Hearing none. All those in favor say aye.
Aye.
Any opposed? All right, motion carries. So we're up to officer elections. I assume we probably take nominations for chair. As Hillsdale County's turn.
Was point of clarification for the bylaws. They're on a rotational basis, so Branch County.
We do the whole. Are there any other nominations? thing?
nominations?
3 times.
Yeah.
Okay. Are there any other nominations? Are there any other nominations? Are there any other nominations?
I think so.
Hearing none. Close the floor to nominations. And I don't know how to vote on it, or we
Yeah.
just like. All right. So we have a nomination to elect Commissioner Leininger as the chair for the Board of Health. All those in favor say aye.
Aye.
Any opposed? All right, motion carries. So I hand it off to you now.
Yeah.
Here you go.
Thank you, Commissioner.
Yeah, you're
And
welcome.
thank you for your last year of leading the Board of Health as the chairperson.
It's been fun for sure.
It's been real. Been real, but
It's all yours. It's all yours now. Yeah.
That brings us up to the selection of a vice chair for 2026 for the Board of Health. And again, for the bylaws, the rotation that will fall to a chairman or a commissioner from St. Joseph County. So do we have a nomination of either Commissioner Hoffmaster or Commissioner Schaefer to that position?
Do the guys discuss that?
We've just, yeah, he just so I take it.
Nominate Commissioner Schaefer.
We have a nomination of Commissioner Schaefer. Are there any other nominations? Any other nominations? Any other nominations? Hearing none, nominations will close. Those in favor of Commissioner Schaefer being the vice chair for 2026 for the Board of Health, say aye.
Aye.
All those opposed, motion carries. Congratulations, Commissioner.
I think. Just beat all the meetings.
That's the name tags, right?
Oh my goodness. That's efficiency.
Prepared.
I guess.
Just like that.
It
Just
just
like
happens
that.
that quickly.
Well, now, that brings us up to the next item of business, 1E, committee assignments. Those assignments are for the bylaws made to the chairperson. And so I will keep the committee assignments the same for 2026. I will continue to have Commissioner Hoffmaster be the chair of the finance committee. But Commissioner Stoll will get to chair the program policy and appeals.
Sounds good. Thanks.
Good stuff.
Next up, item F, approval of minutes of December 11th, 2025. Minutes from the packet.
I would make a motion to approve the minutes as presented.
I have a motion from Commissioner Stoll in support to approve the minutes as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. So that brings us up to item 2 on our agenda, the great opportunity for the public to address the Board of Health. We do have rules for the public speaking at our Board of Health in public chat, which is a limit of 3 minutes. Do we have any public desiring to speak today?
Who's joining us today?
No public. They're just dying to get to the. Well, that brings us up to item 3, the health officer report. Good morning, ma'am. Happy New Year.
Happy New Year. Yeah, Happy New Year. So, and I started out my report, new year, new appointments, but we'll be on that now. So moving right along. In your packet is the audit governance letter. You can receive that advance of the meeting, so it's included for your review. The administrative services team is working hard already to be ready for that visit. Accreditation is the week of March 2nd. So the directors and their teams have been getting us prepared for those visits. You remember last year, at the end of the year, we did the plan of organization. We brought that to you and that was approved. So that's already been sent up to the state office, and actually we've already gotten some feedback that it's fantastic. And so things are moving right along. We're ready to go. So community health improvement strategic plan proposal, you did take up proposal the last meeting, and since then we have now engaged with Mary Cushon, and she has started that process with us, and we will be assigned a Central Michigan University graduate student intern. Mary also works there, so she's able to put us in touch with an intern that can assist and move the work along. So we're looking forward to
I had a question
welcoming
about
her.
that. Great opportunity for a student, I would think.
Right.
What exactly do they assist with?
Well, they'll be doing some of the, paper review of the other community health needs assessments, cataloging data and kind of pulling things together so that it can be brought to us for our review. Mary will take a look at it as well. And then if there are some group focus committees that happen, that individual will probably be involved in some of the questions and gathering the information from that. So that kind of work.
Is the student a person that's local to us?
No.
Or
Mhm. No, attends Central, and so is hailing from that area.
Okay.
Mhm.
But we'll be on site periodically.
Periodically, yeah. I don't know if you guys will get a chance to meet her, but her name is Rama. So I don't know if that'll work out, because she won't want to travel a lot. She's unpaid, so
Right.
it is just an educational opportunity.
Yeah.
All right. I just wanted to share with you about the RX Kids program. You probably are all very aware. This started kind of in the Flint area. It's a public-private partnership program that provides funds directly to pregnant women and families that have just had a baby for a period of either 6 months or 12 months. I know that one of our representatives shared the information about the program out with local leaders, villages, cities, and I know that the city of Coldwater is looking at it. So I don't know if anybody else really, well, I guess we know Hillsdale's. I don't know if they're still the Great Start Collaborative. What used to be Great Start Collaborative, they also had some conversation around it. So we're certainly open to engaging in those conversations. I don't think I have a staff member that could be dedicated to fundraising, which is a big part of that project. The private part of it, pulling those funds in. But certainly we would be supportive of anything that supports our moms and babies here.
This did come before the Branch County Commissioners, I think the finance director at the city of Coldwater. And it does sound like a great program potentially.
Yeah.
We would not be interested in funding anything with the counties on the county's behalf, but it sounds like something that we can certainly support through the various county agencies, I think. So
We can put up enough money to do the match. Yeah. So I guess we'll see. All right, we do have Board of Health Education today. Shelby Ward, who's back there working away, is our clinic supervisor and WIC coordinator. She covers our Hillsville office, and she will be giving us some up-to-date information about the return on investment program here in the Tri-County area, and just a little bit about WIC. So we're glad to have you, Shelby. Thanks for being here. Employee recognition, normally we bring those names to you in January, but then we will end up handing out those actual certificates until our all-staff meeting in April. So we're going to push back bringing those names to you until March, so that it better aligns with our April all-staff meeting. So staffing update, we do have a couple of openings, immunization clinic clerk part-time. Those are actually 3 positions in our St. Joe County office. So they're really short over there. And then we do have an environmental health sanitarian that is leaving us for a state position. So we're very sad to see her go, but that position is also posted and can either be housed at Three Rivers or Coldwater. So we're flexible as our individual can be placed. They will do work in the non-community type 2 water program. So their location is somewhat flexible. Our mobile unit is still on the road. We did decide to cancel our outreach that was scheduled in Litchfield on January 15th due to weather. But Hillsdale Hospital has now stopped using the unit for outreach. I don't think they were seeing the numbers that they needed to continue. So, they haven't ruled out trying again or extending into other areas. But at this point, they don't have any dates scheduled. So that's where that's at.
Has Litchfield's picked up any?
For us. It's, I don't know, it's just tough to get people to engage at that location. So for any mobile
Right.
location. The hospital told me they had a critically ill individual that did seek out treatment at one of the events that they were at, and that individual needed care right now. They were able to basically save that person's life, but one thing like that isn't enough to make it go. But so I don't know. We'll keep trying. I think it does take time to change people's patterns of behavior, so we'll keep trying. But I hope to see it pick up. Influenza, and I think Heidi talks about this today, as well as Dr. Lucarello's report. We are really seeing a lot of flu cases right now. It's very high in Michigan, and not too late to get flu shots. People are still interested in that. And in our Still office, where we have the request for bids out, we've had 4 companies that have expressed interest and walked through the building and taken a look at what's there so that they can bid it. Bids are due next week. I will go over there to accept any bids and open them next week. So we'll see what comes of that. And then the finance committee will have a meeting in February to review that information and hopefully move one of those projects forward to the full board meeting. Dr. Lucarello is out of town. She's at her annual professional development conference, so she will not be able to provide you any verbal comments on her report, but she did submit for you. So if you have any questions, I'm sure Heidi or I can try to answer those.
Are there any questions for the health officer on her report? I have a couple. Becky, what time on 27th are those bids due by?
They're due by 1. And, put on my finger. Let me look. So the bid opens at 1.
Okay, so they're due by 1.
Mhm.
And then when April is the all staff,
April 24th. It's a Friday, and we will be over at, is it called Insight now? The Insight Conference Center. It used to be the old Kmart, for those of us who've been around a while. So we will be in their large conference room that day from 9 until 3. We do have a speaker engaged who will come and talk with us, focusing on wellness as well as how we interact with our clients based on their life experiences. So I'm kind of excited about having him in. His name is Tim Cusack. So he's kind of like our main speaker of the day. And then we, of course, will do other things, so as presenting those certificates, which we hope the chair can come present in person.
that's why I wanted to get that date now.
Yeah, it's in the afternoon, usually when we do that, and if we need to accommodate your schedule, let us know.
I have no idea yet what, baseball schedule will be
Sure.
in the spring, but.
Yeah.
I'm sure April 24th will be a baseball game somewhere,
Me too.
or at least one scheduled.
Yeah,
Any other questions for the health officer? Yeah, I am going to pause here for a minute, and I did double check the bylaws. And Article 7, Section 2 does require approval of the board for those committee appointments, so I would entertain a motion at this time to approve the committees as stated. Support. I have a motion from Commissioner Schaefer, support from Commissioner Stoll to approve the committees as stated. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Okay, moving on, the medical director report, and that is in our packet. Does anybody have any questions about that or? Anything there? Okay. Department report. Health, education, and promotion. Good morning.
So, you may have seen AJ stop in this morning. We did hire Mr. AJ Demond. He is our new educator, has joined the team, and he's really hitting the ground running. He has met with the OHSP grant folks. We have our advisory committee next Tuesday, but he's already been out and met with the groups that we last year. He's met with a contact there and is working on setting up bishop meetings in the 3 counties. He's also engaged another group in Hillsdale, and he's working with getting meeting together with the Quincy, Allen, Litchfield area bishops. So he has been hitting the ground running. We continue to prepare for accreditation and the all staff meeting. Rachel Baker, our part-time community health worker, finished her training course and has received her certification from the state of Michigan. So we have her all set up as a community health worker. And the program had 41 appointments in the month of December. So they are still continuing to have a lot of needs that are out there that we are working through to help people meet. And so I think that is basically the highlights from health education and promotion. Oh, we did launch a webpage specific to the OHSP grant. It's titled For Somebody Safety. I gave you the link there if you'd like to go check it out. It has information about safety tips. It has a link to our map that has the crash data from 2016 to 2024 on it. And it also has links to the resources that have been developed by the agency through the grant around safety.
You said they reached out, he's reached a new group in Hillsdale. What group is that?
The Waldron area group,
I wouldn't say they're Waldron, they're more,
Osseo, area.
Because there's supposedly 20 families moving east of 99 from west of 99. Who the bishop's going to be, I don't know yet. And some of them have moved already, but they're moving because they're going to be a little bit more lax in their enforcement of certain things. So
Well,
a little more like the St. Joe County.
Yeah.
There'll be skid steers in the barnyard and stuff like that.
Zero turnaround boards.
Yeah.
Range counties yet too.
Well, not all of them. You get down to California corners, and some of them down there are.
so, yeah, so we met this past month, with the leadership in that Waldron Lesier area that's currently there. So we'll continue to work.
Because there's that one, but there's this other one that's coming in too.
Okay,
Because you get up there to that ransom area, and there's been that group, and that bishop is extremely hard line. And this other new group is going to be entirely different.
and that you bring up a very good point. It's different from community to community, and we try to work with all the communities, space where they are currently at, and just try to educate. We will be going to, Montgomery Fire Department is having a safety event on Saturday. And so we will be attending that as well. It is specifically targeted to the Amish community coming in to get additional information from the fire department about safety. They'll be doing CPR, stop the bleed trainings, and then they have some other activities they like to do with the community. So
Because they just had that other, major accident involving vehicle and buggy here. December?
there was a crash on December 22nd, and then there was another crash in Hillsdale County this past week.
Yeah. But I'm coming home from Camden Frontier the other night. Come upon a buggy, and I'll tell you, it's really kind of the first time I've seen that group in that area, and they had a flashing light mounted, in the middle underneath on the buggy, and so we are maybe making an impact in some of the decisions there in the community.
The community in that area had already kind of begun to transition to some additional high visibility. So that's been a benefit. And this morning I was traveling through Algansey Township, and there was a buggy in front of me in the low light conditions and snow and low, and they had their flashing red light going, which was very helpful. And they had high visibility. They had a bunch of high visibility tape on the back of the buggies. So I think we are seeing communities making steps towards trying to be more visible. Whether that is strictly due to the work we're doing, I don't want to take 100% of that credit, because I think that there's lots of credit to be shared. On the other side of that, though, we as motorists need to continue to be diligent when we're in areas that we know community live, about just being mindful and maintaining safe distance. Be alert. Don't be distracted. Put the cell phone away. Don't be on phone calls. And just really try to pay attention. And again, I don't know the circumstances around either one of the crashes that have occurred recently to know if there were contributing factors. When I spoke when AJ and I met briefly with a bishop in Camden Township, he thought maybe it had something to do with the fact that the area had very large pine trees, and it was shadowing over the road. He wasn't sure if that was a contributing factor in that case, but so we just continue to have conversation, and we have had some really good positive conversation with individuals, but we as motorists have to do our part as well.
Are they more receptive to the green light as opposed to the amber or the red traveling yesterday on the road, in the road condition, those road commission trucks with the green, that green light goes up much better than even the amber or the red.
We haven't had any conversation. It's something that we're not supposed to have that conversation about. At this juncture, I think we just have to allow things to naturally progress. We need to determine what steps they wish to take to be safer. And again, we as motorists have to be responsible.
Any other questions for Mr. All right, hearing none. Environmental health, Mr. Joe.
Good morning. Morning. Kind of staying pat right now, thankfully. With the busy holiday season over, food section's kind of just getting back into a normal routine. We have had some food illnesses called in that have not met that definition by the state that we've investigated. But other than that, it's kind of calm right now. The general side, not a lot going on. It's really cold. They're not putting septics in. Wells, emergency situations only. I did get the opportunity to go to the on-site wastewater conference up at MSU. Sorry, I had to throw that out.
Go what? Yeah.
It was great. The main speaker, the keynote speaker, was from Atlanta, and he had an interesting perspective about educating the public on their on-site systems, which we've not really done. And he brought up a couple instances that I wanted to share. One was that he was dealing with like their MSUE down there, University of Georgia, and he was talking to folks about, well, you know, don't dump bacon grease down the drain. And he was talking to a family, and someone's like, well, I never do that. I dump it in the toilet. It goes someplace different. And he was like, no, it doesn't. And it all good. Like there was a disconnect, right? Because they just didn't know. So he was talking about some of the outreach things that he does, teaching people about what things you shouldn't be flushing down your toilet, you know, maintenance, that kind of stuff. And I thought, wow, that'd be a really cool way for us to kind of educate people on how to keep their septic systems healthy. Another one that he brought up and was actually on our table was a mason jar full of water that had something in it. And he said, you know, hey, can you grab that, shake it up real good? That's been sitting in there for 2 days. You know, I packed it, drove up. So I'm shaking it all up and it didn't disintegrate. He said, that's a dude wipe. That is advertised as flushable. Okay for your septic system. It goes 2 days sitting in water. You shook it vigorously. Did it disintegrate at all? I was like, oh, still the same. He's like, yeah, just because you can flush it doesn't mean you should flush it. So these are things that maybe we can help educate and let people know, like, yeah, the advertising says you can do it, but it's not a good idea. So they came up with some games and stuff that I'm going to try to implement, and I'm talking to you eventually about putting those together. And maybe when we go to events, that's something that environmental health staff can do, or just even when they come into the counter, just have a sheet educate you, like, just so you know, when you get your new septic and you spend thousands of dollars to get this, don't do this to try to make it last. So I thought that was one of the many things that was very useful. I did go out and do, I'm the standardized specialist for the agency for the food section, and I did go out and do 2 more standardization inspections with the MDARD. That's not in the report. It's just something that happened last week. Just wanted to update you that I'm going through that again, and will be completed second week of February. I'll have the rest of my inspections done, and then I'll be re-standardized and have to go through the whole process all over again. So, and that allows me to go out and train staff on a risk-based inspection model, which the state is wanting all food inspectors to do across the board. So just making sure there's consistency from health department.
He's passing, just so you know.
Yes, I'm passing. Yeah, that's all they pass. So
Yeah.
cool. But I'm happy to answer any questions I have.
I thought there was a lawsuit in years ago on them wipes. And calling them flushable, and they were supposed to do away with them. I mean, not only does it hurt your septic tank, but your cities and municipalities,
Like that either.
it's hard on their equipment. And
It is. So I just
I thought they had a big lawsuit in that they were gonna get rid of all of it.
I don't know about
But then I keep seeing new ones come out all the time.
all. I had my tank pumped November the 14th. And that was the first thing that guy asked me. He's like, "You guys use the flushable wipes?" And I was like, "No, I don't. My son might have." He goes, "Well, I'm just telling you that, like, if I open the lid and I see that, I will not pump your tank, because if I suck that up and it gets into my pump, it's over $1,000 replacement pump." And I was like, "Whoa, I really." So yeah, it's
Well, and the worst part is, I mean, I don't know how you guys are in Branch County, but I know in Hillsdale, I worked at their BPU there for a year. And Hillsdale Hospital, the hospital's worse for throwing
Yeah, I don't
Wait,
think
sure.
it's gonna be like that. Yeah.
down the thing. I mean, we had to put a strainer in, and that still,
they catch it all.
that line was plugged up probably once a month. you know, Trying to get it out of there.
Our jail is bad too. Flush stuff down.
Yeah, they-
Right.
yeah. Also on your radon thing,
Yeah.
I sent mine in,
Okay.
they sent me back a thing, and it did get there within the 11 days. And they said it might have been over, but they didn't really know.
Okay. We can get you.
But they said, no, they said, email me this and we'll send you a new one.
Okay.
So I did, and it took 3 weeks for it to get here from their place.
I asked her to pick it up here.
It's like, yeah, that's what I was thinking. I could have drove to Coldwater.
It's,
We have it in Hillsdale too.
yeah, we have.
Yeah,
all of our offices.
but no, the sad part is that
Well, the sad part
when
is,
I get done with this test now, I don't know if the postal service is gonna get it there
Yeah.
within the 11 days because
the last.
it's taken forever for mail to get to where it needs to go.
Wait for the mother to clear up first. Too.
Well,
Well,
I don't
they
even
see
know if
some
that'd make
over
a
too,
difference. I
so
get
I'm
it
not sure.
there. I mean,
That's the first
Yeah.
I've heard of it, which is disappointing. I'm sorry that happened.
I just thought it was funny. It's like,
No
why
one said
did you have
anything
me
yet.
mail it?
Did you, so I wonder if you put it in the mail on a Monday, would that make the difference? Cause I
I
know.
have no
Postal
idea.
Service
I'm
is
gonna just do one and do it overnighted because it did say that it was in,
Mhm.
they thought maybe it was in the risk area. So I'm gonna do it.
Yep.
I'll just pay the extra postage and
Right.
get it overnighted or a 2-day or a 3-day thing.
That might be something, talking point for the people working the clinic.
Yeah, that's a very good point. We're gonna have to. So it's much the same as like water samples. Don't mail to the state on a Friday because it'll sit
Yep.
there over the weekend and then they'll just dump it out.
oh, well, they won't get it over the weekend.
No, they won't. They'll just
It
sit
will sit in the postal center
there until Monday. That's no
uh,
good.
until probably the next weekend.
Yeah.
I hope not, but that's something we can. Thank you for bringing that up. We'll educate.
Yeah, I
everybody
just,
on
you know, it was just information out of, it is what it is, you know, like, you can't change the postal service and,
that. No, but it's good knowledge to have so that we can try to help people out.
yep.
So I had a question about the radon test as well, since you brought that up. I took one as well, and the directions I read said lowest livable level
Yep.
is where you put it.
Yep.
So that's where you live, right?
Correct.
Well, Commissioner Houts and I were talking about this at our board meeting actually, because he put his in the basement and I put ours on the first floor.
Yep.
And ours came back fine. Everything was good, but his was high, I believe.
We try to educate people on that because they just assume, well, it goes in the basement because
Right.
that's where, it could be open and
Sure,
exposed.
sure.
we want it where you're being exposed to the most air, which is the lowest level in which you live and spend most of your time, which is typically.
Yeah, I mean, it certainly could be the basement, right? If you
It
have
could be, if that's where
basement.
you're, you have a home office and that's where you work all day.
Right,
Yeah,
right.
absolutely.
Yeah.
Typical forced air furnaces are taking air from everywhere and blowing it all over. So it should distribute the air.
Sure,
evenly.
sure.
But yeah, I would recommend him. I mean, he came back high, come back and get another one and pull.
Yeah, it's-
What does that put near the thermostat?
Year.
Doesn't it say that on there? No?
I hung mine on my lamp.
Yes.
Yep, lamps are about the best
Great
type.
place to put it.
They work really, really well.
The basement is where my wife has banished our kids to the last 4 days.
So you may want to test that.
Your schools, therefore you live in the basement.
Yeah.
It's a good idea to, if they spend time there, go get it tested.
Yeah, I was just curious about it. So,
All right. Any other questions? Hearing none, moving on. Miss Laura,
Morning.
good morning.
Happy New Year.
Yeah.
Just a few enclosures this time, our first quarter programmatic report for the Victim Assistance Program. We are still seeing, multiple referrals and very complicated, complex cases. It's just extraordinary, to hear some of the cases that we're working on and the ways that we're supporting people to live independently and safely in the community. We are super excited to continue planning the Elder Justice Symposium, although we're having a hard time getting a venue. So I need to follow up perhaps with the undersheriff because we emailed him a couple weeks ago to potentially use the FOP lodge. Where they do a lot of training for law enforcement. And since a lot of the participants for this symposium will be from law enforcement, first responders, those types, we thought it might be an applicable request. So just sort of as a, I don't know, as an aside, I might be reaching out to see if could be a nudge that one of our St. Joe County commissioners could offer up as well if we have a hard time. March will also be busy for our team in regard to the Victim Assistance Program because we're undergoing our every 2-year contract review. Did some internal planning and our first call with the DVS staff, and Teresa's team and our team will be busy preparing and sending documents. We're at a lower risk level this time, so that felt good to hear. They're not going to be as asking for as in-depth redacted case notes and those types of things, which is a good sign. That's I took it as a compliment because we have been so thorough in our past reviews. So we're looking forward to that. I've already also provided documentation for the financial audit that Rebecca reported on senior. So it's busy first quarter of this calendar year, that's for sure. The budget update, we just heard that Congress did release a bipartisan funding package for 2026. They're saying that the House should vote this week and the Senate next week. This flat funding for Older Americans Act programs, which is better than a continuing resolution. So we're gonna hope that this labor HHS bill goes through as it was initiated bipartisan. In bipartisan fashion. So let's remain hopeful there. The my option. Oh, Denham's back in the room. I saw that you had left for a minute. It's my pleasure to introduce Denham Babcock, our new nurse care consultant. She started mid-December and has a neat background and experience with some specialty areas as well as some acute care. But she's falling right into place with all the data systems that we use. Understands the person-centered approach and is very open-minded to learning and absorbing all the things. So I don't know if you have any questions for Denham or but she is here to answer those if you do have any. My options, boy, did we end the calendar year of 2025 mid-December ended the open enrollment period. Our team was certified mid-open enrollment period,
and they still served like 70 people. I was just amazed. We ended up taking overflows from Burnside Center, as well as from Calhoun County, because all of those teams were filled, in terms of their appointments. So we helped fulfill, some need there. So that was great. As a region, so you add in what St. Joe County did with their, Medicare counselor at the COA, and then the 3 or 4 that were on, from Burnside, and we served over 400 people during open enrollment. Jane, our part-time outreach specialist, did decide to move on in later December, and we just received notice this week that Susie will be moving on. So I'm gonna be posting that a full-time position here very soon. We did apply for a grant called Senior Medicare Patrol. This is a grant that's been done for years through the Aging Network, but the state decided to rebid it. And so we decided to go bigger, go home and ask for the max amount. So hopefully we'll be awarded at that amount or a reduced amount, we'll see. Once we have the award in hand and have negotiated through with the Bureau, I'm going to remain positive, that we'll get a decent amount to be able to support some Medicare fraud, abuse, and awareness prevention type efforts to make sure people understand where to go if they get an odd looking bill, or maybe an explanation of benefits that includes a service that they don't remember ever having, and can help them tackle that. So we'll bring that up to finance and the board once we're awarded and have a solid number for you. I think that's all that I have in terms of updates. Any questions?
Any questions for Laura? Hearing none. Moving on. Heidi,
Good morning. Just a few updates. I did include some info from the statewide respiratory dashboard regarding the Michigan resident vaccination rates. Influenza is only at 24.6 and COVID at 8.6, but our RSV for ages 35 and over is at 42.5. As of January 9th, the influenza-like illness activity in Michigan is very high. Like Becky said, we're actually at the top of the scale. Activity is expected to continue like that for several weeks, and it's anticipated in February. Nationally, I did give a little update as of this morning. There's now 32 pediatric influenza-associated deaths for the 25-26 season, and 9,300 nationwide. Michigan, as of today, no confirmed pediatric deaths this season. Predominantly, the strain is the influenza A, the H3N2. From December 28th through January 3rd, 97% of the cases were influenza A, and then over 90% of those were subtyped and identified as a subtype variant. So I think that mixed with low vaccination is part of our issue. As far as measles, there's a new case confirmed December 16th in Oakland County, which brings us to 30 total confirmed cases for Michigan for 2025. We still have plenty of flu, COVID, RSV vaccines available at all our locations. I added some numbers here. Between September 1st and January 11th, the agency did administer 452 flu vaccines. That's 153 high dose for the older group and 299 standard doses. Some outreach and community efforts. We have scheduled Project Connect on January 29th. We'll be offering free flu vaccines along with private, but we do have a handful of free available if they're needed. We are back doing the county jail vaccination visits monthly for Branch and St. Joe counties. And we're actually seeing strong participation and positive reception from the inmates who are going there. So that's good. Like Becky touched on, Shelby's going to give us more of an update on this afterwards, but the fiscal year 2025 participation in food cost report was distributed. That report just highlights economic impact of WIC in our community and demonstrates how the WIC benefits are being used. Children's Special Healthcare, that team just continues to get all the information into the electronic medical record. It seems to be taking some time. Hearing and vision, kindergarten roundups are already being scheduled for the spring. And for COHA, we are kind of seeing an increase in opt-outs for this year. We just think it's related to limited awareness and understanding of the whole program. So we're just working on ways to get that education out there. That's all I have.
Any questions?
Quick question, the influenza A that you just spoke about, how are you gathering kind of data for that? Are clinics kind of reporting or making calls?
As far as the illnesses,
Yeah,
so well, I get this from the state
oh, I see,
dashboard,
okay,
but I do get every day I check the Michigan Disease Surveillance System and go through it, and I hear everybody from our. But again, those are only people that have been.
and is that kind of voluntarily reporting? Cause I'm not sure they report that, Rich.
Voluntarily, but like long-term care facilities, they have to.
Oh, yeah,
Yeah.
okay. We're seeing a lot of it.
Those are probably electronically sent to us.
Any other question?
I just had a question about the K variant issue. That so clearly wasn't included in the vaccine.
Yeah, no.
I mean, of course, vaccine's still a good thing to get.
Yeah.
Has there been any analysis? I guess it's probably too early to even know this, but if it does still help,
They're saying that it does.
okay.
And a lot of it is, we're seeing more B2, I think, lately, but they still say that it will help.
Okay.
Limit the effects.
Any other question? Question I got with the CDC changing the immunization recommendation call. Will that impact our ability to bill and receive payment from health insurance companies if we're not following that CDC protocol and that immunization?
That's not supposed to. They're just recommending really, like CDC is just in very clinical decision making. But I just watched a video yesterday that it's not supposed to have any impact on. It's a group.
Something you want to add?
With increasing health insurance costs and reimbursements, I anticipate that the insurance states will soon follow, especially Medicare and Medicaid will soon follow the CDC guidelines. And so I would say you're probably gonna start to see a
I think it's still probably kind of early, so
I think Michigan's gonna pay really close attention to that.
yeah.
And we'll know if there's gonna be, we'll get some changes there.
And I thought the recommendation was just to not make it mandatory, but you could still get all of them if it was between you and your doctor's choice.
That's my understanding.
That's how I understood it. I mean, they're not saying that it's banned, you know.
well, sure, but in the past, some of those were vaccinations were required to be covered 100%. And I'm just wondering if that's,
I mean, the BFC programs are all still offered through that. It's changed there. I'm sure there's.
any other questions? Hearing none, moving on to item 6A, payment. Those are listed in our packet, and that is for the month of December 2025.
That is correct. Page 40 through 42 is the bills for December 2025. Really not much unusual, nothing in there that I think I need to point out.
I'd make a motion to approve.
And a motion from Commissioner Tolan with support from Mr. Collins to approve those payments as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next is the review of the financials, as of November 30th. And we have a December 31st as well
Yes.
in the packet, so.
Yeah, so due to the timing of when the board meetings were, you do are, get to approve 2 months at the same time. I'll focus on December because November is a point in time and it's already passed. So I'll talk about, December. I'm happy to answer any questions you have. You do have the balance sheet in front of you and, cash receipts and disbursements. And then the monitoring part of it, where we monitor how each program is doing. Overall, we're 0.75% under budget, so just a little less than 1% under budget. And we're closely watching some things. A lot of programs are showing over, especially high staff programs. And this has to do with the HSA contribution. So I know that the HSA contribution was made in January. However, the way our system works, because the payroll, 80% of that January payroll, this is paid as a payroll benefit, 80% of that January payroll was paid, all of it was paid on January 2nd. But the system says if 80% of it was in December, 80% of those expenses belong in December. And it didn't allow us to pick and choose which 80% of the payroll went there. So 80% of the large contribution to the HSA hit December, the other 20% will hit January, but that's a one-time expense that does bring expenses up. We expect it to fall back in line as it goes forward. But you are seeing some effects of that payment in December, even though the payment was not made until January. I would be happy to answer your questions.
Any questions? Hearing none, I'll entertain a motion to approve the month-end financial statements as presented.
November and December.
November and December.
So moved.
I have a motion from Commissioner Stoll and support.
Give it to Rick. It's his turn.
For Robert's rules, whoever made the support is not required to be noted in the minutes.
I'm kind of doing it.
It just, Robert's rules just requires that there be support, so.
Good to know.
We, on the financials, any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Committee reports. Finance Committee did not meet, nor did Program Policy and Appeals Committee meeting this month. So I believe Finance Committee, you said we'll have something in February, so. And who knows where we'll be on Program Policy and Appeal. Item 8, unfinished business, there is none. Item 9, new business, and this is just here for our review, is the bylaws of the Board of Health. And these bylaws were last amended February 27th, 2025. Just review those, Commissioner, if anybody has any thoughts, any changes or updates to that. A reminder that for the bylaws, those would have to be presented to the Board of Health at least 10 days prior to any meeting to amend those bylaws. So, any questions or comments on those bylaws as presented? The next item is a audit governance letter from Manor Custarian. And Manor is the auditing firm that we are using this year. We're in contact with them for three more years. The required documentation that they provide to us. Will any of their staff be reaching out to any of the members of the Board of Health? I know on the Wellwise board, when I was chair, I would routinely get a conversation with the auditor at audit time, just ask some questions if there was any concerns. I don't remember them, Manor, ever doing anything like that here.
So they do choose to talk to, they randomly select folks to talk to. It could be a member of the board, it could be members of staff, but they do some interviews of that type. I'm not ever aware of who they choose. So I don't know who they've chosen in the past. They don't ask me and they don't tell me who they choose. I just know that they do.
That is a good question, though. I didn't talk to him last year.
And I don't remember.
I do think that it's customary to speak with at least the board chair.
And as budget chair, the county, I've had, a similar conversation with their auditor there, so.
I mean, if you'd like, I could ask them to put you on the list.
Well, and the question would be, and my thought, it probably should be Commissioner Stoll, because he was the board chair during the, for the fiscal year that we're being audited.
I do think it'd be a good practice. I mean, I'd be fine if they reach out to Brent actually, but I think it would be a good practice with the at least contact. I don't anticipate any issues, but it's good.
You're right, it's just that, auditing practice. Any other comments regarding the audit governance letter? Hearing none, that brings us up to item 10, public comment. Okay. Tom?
May I ask a question?
You may.
For next month, your education that's scheduled after the board health meeting for that day, are there any special requests in this group? Would you be interested in us diving into the finance piece again? Or do you feel that we've done that enough for you?
I am. Whatever you decide, I'm good. Whatever you. Yeah.
When was the last time Andrew was here and gave a presentation? Was
Last
that?
year about
It was
this
a year
time.
ago, and I don't know if we need him back again.
I mean, yeah, that's why we brought him back last year, because it was the first year, right? And then he did Open Meetings Act and I think conflict of interest, right? So, and we can certainly ask him, but
There hasn't been any changes to the OMA yet. There's been talked about some changes, but I guess can't say there hasn't been any because what has maybe changed doesn't affect us though. We're not a state. Certain state boards that can now meet remotely that we can't, so. Maybe. Just a thought, maybe somebody from our insurance provider on risk mitigation for the agency.
okay.
And again, just a thought.
We've never asked MMRMA to come in. So that would be different.
What can we as a board do to help mitigate risk and make sure that coverage protect the agency the way it should? Any other commissioner comments before we adjourn? Brings us up to item 12. Entertain a motion to adjourn. Support. Motion from Commissioner Schaefer to adjourn. Support. All those in favor say aye.
Aye.
All those opposed. Motion carried. We are adjourned.